We need to raise the issue of stigma because if we don't talk about it, we can't address it.
We need to raise the issue of stigma because it's such a big building block. It's the thing that stops people seeking help. It's the thing that gets in the way of people even acknowledging that there is a problem. Stigma impacts people negatively in a way that they may not even realise. From the things that they feel comfortable to tell trusted health professionals, to the way that they interact with families and friends, and even the way that they show up at work.
There is a lot of stigma. There are a lot of people who do not wish to engage with treating people who have got drug and alcohol problems, nor their affiliated problems, because often there's an increased level of difficulty. The patients themselves feel that help isn't available, so they run away from help. And as a consequence of that, they don't get any help, so we don't actually address the problem. Simply put, if we don't deal with the stigma, we're not actually addressing the needs of the patient.
I guess the worst examples I can think of would be people who actually have come in for treatment well past a time when we could help them. And also, I have actually witnessed somebody who ended up having an amputation from leaving something for too long, and the reason they did that, of course, was because they were expecting not to be treated when they arrived.
Meeting other nurses or even student nurses about working in AOD, a lot of the reservations come from the stigma that AOD patients are aggressive, they're all criminals, they're all violence, that they don't know what they're doing, that they're going to be so high that you're going to get attacked. There's a big risk, there's needles everywhere. And that's not the reality of the sector. There's a lot of support. The majority of these people want help, they want to get clean, they want a better life.
A time back when I was a junior doctor, and this is a story that impacted me quite deeply. So it was a patient who had a heroin dependence who presented to the emergency department multiple times with severe back pain. And I was one of those doctors, probably during the fourth presentation, and I was delayed in seeing this patient, so the patient left without being seen. And in my head I was relieved because I did not need to see this patient who I thought, oh, this patient used heroin and complained of back pain, probably just wanted to get pain relief from me. So, but then after the seventh presentation, we found out that this patient actually had spinal abscess, and so this was my experience of being faced with a patient who used substance, who had discrimination or stigma in healthcare, and I was unfortunately one of the perpetrator, even though I never met the patient, but I contributed to this patient having delayed of care.
If I could change one thing now to help people seeking treatment, it would be to change people's attitudes. If we can come from a place where we respect people and treat everybody equally and fairly, it's the attitudes. I mean, there's always the thing about more time, more money, and often we can't do anything about that. But the one thing we can do is we can change our attitude and not look at people in a negative light.
By having the conversations, by raising it, we actually destigmatise. The elephant in the room disappears. And as a GP, I feel really privileged to being able to help my community in an area that really affects everyone.